liters per minute, and FiO2. So liters per minute, or LPM, this is the flow rate that is set. Some devices require a certain flow, like a simple mask needs a flow of at least 6 liters to flush out the mask. This is to eliminate any rebreathing of exhaled gas and to provide fresh gas for inspiration. The high-flow nasal cannula system uses flow, liters per minute, to offload the work of breathing. In this case, the flow is titrated to the patient's needs. FiO2. This is the fraction of inspired oxygen, given as a percentage. Room air is 21%, and supplemental oxygen can be delivered up to 100%. Some devices are set at 100% oxygen, like a simple nasal cannula. This does not mean that the patient is receiving 100%. As nasal cannulas are low-flow devices, the patient is able to entrain room air around the nasal cannula prongs, or they can breathe through their mouth. This dilutes down the 100% oxygen that is being delivered. The high-flow nasal cannula system allows for the FiO2 to be titrated on a blender from 21% to 100%. This ensures that the patient's targeted oxygen saturation range is met, as you're able to titrate the oxygen as needed. Oxygen flow meters are green. As you turn the wheel, the flow increases and the ball rises. You read the flow by looking at the middle of the bowl. The blender gives the ability to titrate the oxygen from 21% all the way up to 100%. The devices shown below are all run at 100% oxygen. A simple nasal cannula typically run up to around 4 to 6 liters depending on the size of the cannula. A simple mask is run at 6 liters. You're unable to wean on the simple mask. It needs enough flow going through the mask to ensure that it flushes out any exhaled CO2. So if you're going to wean from the simple mask, you'll need to go to a simple nasal cannula. A non-rebreather is what people take when the patient is desaturating and they need to get some high flow oxygen on immediately. So the flow runs at 10 to 15 liters per minute, which means the reservoir bag should fill and it should stay inflated during inspiration. Trach collars are run at 10 liters. This is to ensure that there's a fresh gas source available to the patient and that CO2 is flushed out of the trach collar. The FiO2 can be titrated from 21% to 100% to achieve the targeted saturation ranges. High-flow nasal cannula utilizes both the flow and the FiO2. The flow, or liters per minute, is adjusted to offload the work of breathing. The FiO2 is titrated via the blender to maintain the ordered targeted saturation range for the patient. So you may have a patient that needs 20 liters of flow to offload their work of breathing so that they have enough ready available gas source to inhale, but their oxygen requirement may be very low. So both of these parameters can operate independently. So final thoughts. Look to see what your patient is receiving. Is the liter per minute and FiO2 set by the oxygen delivery device? Or are they receiving therapy where they can offload their work of breathing, as demonstrated by the liters per minute flow, and we're meeting their oxygen target saturation ranges by titrating the oxygen?